Imagine waking up tomorrow to find that the health benefits you've relied on for years have been drastically changed or even taken away. For millions of Americans, especially seniors and low-income families, this isn't just a hypothetical scenario. It's the ongoing debate surrounding Medicare and Medicaid under Donald Trump's healthcare agenda. Let's dive deep into what's at stake. Healthcare has always been one of the most polarizing and consequential policy arenas in U.S. politics. At the center of this debate stand Medicare, the federal health insurance program for seniors and certain people with disabilities, and Medicaid, the joint federal-state program providing coverage for low-income Americans. When Donald Trump entered the White House in 2017, he promised to repeal and replace the Affordable Care Act and reshape America's health programs. But what did his administration actually do? What were the stated goals? And how might these moves affect the future of Medicare and Medicaid? In this script, we'll break down Trump's healthcare agenda, focusing on how it impacted and could continue to impact these two cornerstone programs. Before understanding Trump's agenda, it's crucial to grasp the basics. Medicare was established in 1965 to ensure seniors and certain disabled Americans receive hospital and medical coverage. It's largely funded by payroll taxes and premiums. Medicaid, also established in 1965, covers low-income individuals and families, including children, pregnant women, seniors needing long-term care, and people with disabilities. It's jointly funded by the federal government and states, which gives states some flexibility in implementation. Both programs represent safety nets that millions depend on, over 65 million Americans on Medicare and more than 80 million on Medicaid as of recent counts. During his 2016 campaign, Trump repeatedly said he would save Medicare, Medicaid, and Social Security without cuts. However, his administration's policies told a more complex story. While Trump often pledged to protect Medicare, he supported Republican proposals that sought to curb federal spending on Medicaid and alter its structure. One of the biggest shifts Trump's administration pursued was changing Medicaid from an open-ended entitlement to a block grant or per capita capped system. Block grants would give states a fixed amount of federal money, allowing them to design their programs but also limiting funding growth over time. This move was framed as increasing state flexibility, but critics argued it could lead to benefit cuts, stricter eligibility, or reduced services. In addition, the Trump administration encouraged states to implement work requirements for Medicaid recipients. Several states, like Arkansas, received federal waivers to condition Medicaid coverage on employment or job training. Critics warned these rules would disproportionately harm vulnerable populations who already face barriers to work, including people with chronic health conditions or caregiving responsibilities. The Affordable Care Act expanded Medicaid eligibility to millions of low-income adults. Trump and congressional Republicans repeatedly attempted to repeal or weaken the ACA. The 2017 repeal efforts, particularly the American Health Care Act, aimed to roll back Medicaid expansion and fundamentally restructure Medicaid financing. Although the repeal effort narrowly failed in the Senate, the administration later took steps to undermine the ACA through regulatory changes, shortened enrollment periods, and reduced outreach funding, all of which indirectly affected Medicaid enrollment. While Medicare faced fewer direct attacks, Trump's budgets proposed hundreds of billions in cuts to Medicare spending over a decade. These cuts were often framed as targeting waste, fraud, and abuse, or reducing provider payments rather than cutting benefits directly. Still, experts warned that such reductions could impact patient access to care if doctors and hospitals received lower reimbursements. At the same time, the Trump administration promoted Medicare Advantage, the privately run alternative to traditional Medicare. Enrollment in Medicare Advantage plans grew significantly during his tenure. Supporters saw this as offering seniors more choices, while critics warned it could erode the traditional Medicare program over time. Trump also pursued reforms aimed at lowering prescription drug prices, a key issue for Medicare beneficiaries. His administration introduced rules to allow more transparency in drug pricing, push for importation of certain drugs from abroad, and test new payment models in Medicare. While some initiatives showed promise, many were challenged in court or remained incomplete by the end of his term. The combined effect of these policies would likely hit vulnerable populations hardest. Seniors on fixed incomes could face fewer provider options under Medicare pets. Low-income families and individuals could lose Medicaid coverage due to work requirements or funding caps. States could gain more control, but also more financial risk, potentially leading to coverage disparities between states. Trump's healthcare agenda reflected a broader ideological push to reduce federal responsibility for healthcare programs and shift more power to states and the private sector. While supporters see this as encouraging innovation and efficiency, opponents warn it undermines the universality and stability of these programs. The long-term question is whether Medicare and Medicaid will continue as robust federal entitlements or gradually evolve into more state-driven or privatized systems. As the dust settles on Donald Trump's presidency, one thing is clear: the debate over Medicare and Medicaid isn't going away. Whether you're a senior relying on Medicare, a low-income family depending on Medicaid, or simply a taxpayer concerned about the future of healthcare, these programs touch us all. Trump's healthcare agenda sparked major conversations about how much government should do and how much responsibility should shift to states and individuals. What happens next will depend on Congress, future presidents, and the American public. The choices we make today will determine whether these safety nets remain strong for the next generation or transform into something very different.